Yo, everybody. It is your friendly neighborhood physical therapist, Dr. Ryan Welton, coming to you from just outside the Tampa Bay area. If you are new to following me, I have a clinic where my clinic, most people have, like, I call it the failed everything story. Um, you know, Nobody knows what's wrong with me, that kind of thing. I figured out how to get exceptional results over the years in that patient population. I have published statistically historic papers in readership in the field of orthopedics. I have I've published multiple papers. You can find them at weltonmethods.com, and the link should be in the bio. Also, I am teaching in my free VIP school group, which should be linked right here. Click on that, join my group, and I'm teaching much more in depth. My clinical mentorship is now live, where I teach you clinically, and then also I am teaching. Also, you get 59% off my courses in this clinical mentorship, with like the one that everybody loves, the myofascial course with the 1,000 pages of maps of the body. When I published it, I described them as reflex pain points. It shuts off pain immediately. I described in the paper. And then also my cash-based clinic. So I developed a seven-figure cash-based business model, very different from everybody else's, based on clinical results. So I combined the two and created this hybrid course where you have the skills to be able to charge $400 for 30 minutes, but also the confidence that you know that you're not worried. Like, the kicker with me is I do the same protocols with all different diagnoses, all the same diagnoses. So people all over the world have been cutting and pasting what I'm doing. So join that group, click the link below, where I'm teaching more in there. Okay, so I touched on this yesterday, but I feel like I need to go over this one again. I have been doing this physical therapy thing 20 years. And this was the first I've heard this one. I always thought no one could shock me anymore. I thought I had heard it all. But so I evaluated this patient yesterday. And this is what she told me. A year ago, she was just sleeping, okay? And she woke up with massive back pain, okay? And going down her left lower extremity. I asked into the foot or just to the ankle. She said the ankle. I'll tell you in a second why. She has disc bulges, but they were like mild to moderate type thing. And they did multiple doses of prednisone packs, which helped. They usually do help, but it's just a mask of it. But she's a nurse, and she's like, I know I'm just managing symptoms, but I don't know what else to do. She's like, I can't stand up anymore. She did 10 weeks of physical therapy, no help. Multiple injections into her spine, facet joints trying to target these discs. Then they did a caudal nerve injection. In the caudal nerve injection, she said for 3 months paralyzed my vagina and my rectum to the point that she was defecating on herself and also having vaginal issues from that. They sent her to a rectal specialist, but her insurance wouldn't let her go to it type thing. Gotta love insurance, right? Anyways, and then after she came back because they wanted to do more injections into her spine. Now, when I started, when someone starts in on this story, I immediately start thinking something that doesn't show up on X-ray and MRI. Okay, and what doesn't generally show up on X-rays and MRIs? SI joint dysfunction, sacral torsion, sacral shear, which is shearing bone pain. Okay, shearing bone pain. See this here? Can you see these jagged edges? They start shearing like that. It causes, people think SI is like just some pesky thing that hurts on the side. No. This is an SI joint preferred pain chart right here. When I showed her this, she said, "That's me." And I'm like, "Yeah, I know." So this right here is an SI joint preferred pain chart, but this is over the years of having basically an SI joint clinic or a chronic back pain clinic. What I found is that you can actually get all symptoms of sciatica, including numbness, weakness in my patients. I have 2 videos on my root cause of SI joint dysfunction paper found on my website where I show drop foot and how I realign it. And the person's drop foot goes from like 3 out of 5 to 5 out of 5 right then and there. But also across the back. And this lady had pain all across of her back and then down her leg. Okay. Now, when I assessed her, what I did was this. So I put both of my, the nominate on this side too, right? Both of my thumbs on the PSIS, I had her extend back. And my left thumb, was my left thumb, translated superiorly. And my right thumb translated inferiorly. They're both supposed to translate inferiorly, go down with the sacrum. But when it's flipped up like that, it goes like that. So it's translating superiorly, right? So I pulled on her left leg, okay, brought that down into alignment, okay? But I wrote up in my paper that in the root cause of SI joint dysfunction paper, I described that SI joint dysfunction, a proposed cause, is caused by an upslip and or out flare. Up, out, okay? That is what I proposed. I do this all day. I realign upslip and or out flares all day long. Like literally 6 today, okay? Something like that, okay? And then I also find that the person has a sacral torsion, okay? Like that, rotated like this. And I always find, for some strange reason, that the right piriformis is weaker, and this twists always this way, where you have to strengthen the right piriformis to bring it back. Okay, now I will show you on my assistant what I did with this patient. Hey, Nat, can you come here for a second? Sign up for my school group for more teachings like this. Okay, I go much more in depth, and I even have massive discounts. The link is right there for my courses. Massive discounts for my courses. Okay, as well as weekly mentorship where you live Q&A, all that stuff, as well as cash-based clinic stuff, where I teach that as well. Okay, so face this way for me, please. So, what you want to do is palpate the PSIS. The way that you do that is you find the knobs. Find the knobs where your thumbs like go right over it, and then that's the PSIS. So I asked this lady to extend back, and my left thumb translated superiorly like that, okay, which told me she had an upslip, okay? And then I describe it in my sacral paper. You can read on my website. I describe it that you do it in prone, but I actually do it in standing. Some people say they can't do it in standing, but what I do is I move down to the ILA here, inferior lateral angles down here, and I have her bend forward. Go ahead, bend forward for me. And when she does, my left thumb dips in like that, which tells me that she has a sacral torsion. And when that happens, you can get this buttock pain that doesn't show up on x-rays and MRIs, usually diagnosed as a piriformis spasm. I don't like that term. And the reason why I don't like that term is because what's causing this piriformis spasm? Is it herniated disc? Is it the fact that your piriformis inserts right there and it's rotated and it's causing pain in there? They usually take their hand and go like that when they have a sacral torsion. So, and that causes a shearing pain at the base of the spine, which can cause all kinds of achiness and all kinds of pain in the back. Now, what I did to realign her, I had her out of pain. Real quick, lay on your back for me, please, Anna. So what I say is, I'm going to pull on your leg. It does not hurt. It's just a little bit of a tug. Is that okay if I do that? And what then my next question is, have you ever had hip surgery? And because if they've had a total hip replacement, you pull on their leg, they go directly to the emergency room. Okay? No bueno. All right. So what I do is I don't pull below the knee because I don't want to hurt the ligaments in the knee. I pull at the hamstring right here, and I relax, 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 and then I just drop my hip and have her slide on the mat. Now I usually do it about 3 times, okay? And then you have to stand up and you check to see if both thumbs are dropping in the test we just did, okay? Lay on your side face this way. Now I found that in my patients and in the paper I published that as a joint dysfunction proposed in there is caused by an upslip and or out flare. So I just realign the out flare. So I'll take like a high drop pad and I push medial on the ASIS like this. So I push medial on the ASIS like this. So I was pushing like that, okay? And I was gapping the out flare open, okay? Then lay on your belly for me, please. I showed you how I evaluate it and standing. Some people say they can't do it. So relax your butt for me, please. Both thumbs on the ILAs, hands next to your shoulders like you don't do a push-up on it, please. Keep your butt relaxed. They have to keep the butt relaxed. If they don't keep the butt relaxed, then you'll miss it, okay? Press up. And what I always see is my left thumb dip in like that, which tells me they have a sacral torsion. So what I do is I just push on the sacrum this way, that way, okay? I do it for like 20, 30 seconds and get it back into alignment. And I had her stand up. Stand up for me, please. And then arch back for me, please. And what she did was like, no, all my pain's gone. And in my leg, right? Thank you, Annette. And in my leg, which it came out of her back, okay? Which told me that that was what was wrong with her and that it was a mechanical issue. All day long, I see mechanical issues, okay? All right, so if you click that link below, join my school group or go to weltonmethods.com, hit courses and become a VIP member. And that will bring you to the school group, okay? Where I teach much more in depth, okay? And you even get massive discounts on my courses in there. And also I teach people how to open and run cash-based clinics. Like I have a 7-figure model based on results. So different. So most people I've been following, and I've been really doing like a deep dive into this cash-based business industry because I've been teaching on the DL for a while, this totally different model where there's no sales tactics. I'm not a salesperson. Most people aren't salespeople. We're healers. We're not salespeople. So what I do is I actually just get the person out of pain, like this lady. And when I get her out of pain, she trusts me. You know, like I don't need to manipulate her brain and tell her like, oh, well, you know, all these fancy sales tactics. No, I just get her out of pain, use my clinical skills, demonstrate that I'm an excellent clinician, and then people want to work with you. That's how that works, okay? And you back it up with your clinical skills and you get paid for, you know, I get paid $400 for 30 minutes. That's what I do. And I teach people, I've taught people how to do this, okay? And that's what I'm doing now. All right, gotta go. Peace, love you all. Join my group.